Thank you, Mr. President. Mr. President, I come to the floor today to talk about a drug abuse problem that is hurting millions, literally millions of Americans. There's been a dramatic rise in the use and misuse of prescription painkillers in this country. These prescription painkillers, and I tell you this as a doctor, are known as opioids. And between 1999 and 2013, sales of prescription painkillers in the United States has quadrupled. So it's no coincidence that over that same number of years, overdose deaths from these drugs has also quadrupled. Now, this is how we know that there has been a huge shift from the appropriate use to abuse of these medications. People in rural areas like my own are almost twice as likely to overdose on prescription painkillers as people in large cities. Some people think that these drugs are only a problem in the big cities. Well, that's not the case with these opioids. I can tell you as a doctor who practiced medicine in Casper, Wyoming for 25 years, treating pain in our patients is one of the most difficult things that we do. When you have a patient, we know they're in pain, we want to help. We want to help relieve the pain. Opioids are a very effective way to help patients with pain, and doctors use these medications through prescriptions to help manage the pain. It's important that we have the capacity to do that as long as it's done appropriately. Now, this can be a very good option for someone suffering from chronic pain, such as pain from cancer. It can be appropriate for someone who is suffering from acute pain, temporary pain for someone who's just had a surgery. The problem is these are extremely powerful narcotics. Chemically, they're not that different from heroin, and they can become addictive. Some patients have no problem at all taking these painkillers for the proper amount of time. Other patients might develop a problem and actually have trouble getting off of the pain pills. Now, as they get accustomed to the drugs, sometimes they may seek out stronger and then more addictive drugs to get the same pain relief. That's why doctors have to be very careful about prescribing the right medicine for each patient and each situation. They have to balance the risk of the drug with the reward of easing the patient's pain. Not every doctor in this country has been as careful as they should be. We didn't get into this difficult situation because of a handful of doctors who are just writing too many prescriptions. These prescriptions are being written by doctors in communities all across the country. It's happening in emergency rooms. It's happening with family doctors, with specialists, and even with dentists. Now, I believe Washington policies have inadvertently contributed to the problem. The Centers for Medicare and Medicaid have made payments to hospitals based partly on how well the specific hospital has scored on surveys filled out by the patients who have been in those hospitals. Well, some of the questions on these surveys ask people things like, and I'll just read a couple to you, during this hospital stay, how often was your pain well controlled? So patients are asked that. And they're also asked, how often did the hospital staff do everything that they could to help you with your pain? Well, you can see how doctors might feel pressure to prescribe more and stronger opioid pain relievers to make sure that their hospital doesn't get low scores and get penalized by the bureaucrats here in Washington. The Department of Health and Human Services is looking into whether these surveys are contributing to this rise in prescriptions and what can be done about it. Earlier this month, I was one of 26 senators, 26 members of this body, Republicans and Democrats alike, who wrote to the Secretary of Health and Human Services to make sure that she keeps us apprised on the effects that these regulations might be having. If these pain relievers are being prescribed inappropriately, they can do more harm than good. That's the problem. Some of these people who do get these prescriptions for all the right reasons end up being addicted. When the prescription runs out, they may actually experience withdrawal symptoms, and I've seen it happen. So we know that some of the people who become addicted to these opioids, then what do? Well, they seek pills on the black market, or they turn to other drugs, including heroin. Heroin is often cheaper than the actual prescription opioids, and of course, more deadly. From 2002 to 2013, heroin use in the United States has nearly doubled, and the deaths from heroin overdoses has quadrupled. Why? Well, one of the reasons seems to be that because heroin has gotten much cheaper on the street, it's also become more attractive drug for addicts to buy and to use. At the same time, the heroin today is believed to be much more powerful than it used to be. And so it may be that people who use it are much more likely to overdose. When we see statistics like these, or just talk to people who work in emergency rooms and deal with the drug addictions and the 911 calls and opioid abuse and heroin abuse, and we see these problems, I think it's time for Congress to act. We can't turn a blind eye to Americans who are suffering and who are dying. That's why I think it's important that the Senate has to be taking up action to help stop the damage being done. Recently, the Senate Judiciary Committee passed the Comprehensive Addiction and Recovery Act. Bipartisan support, and it's one more sign that the Senate has gotten back to work on behalf of the American people. Just like the name of the legislation says, it actually addresses both problems, addiction and recovery. It's going to increase education and prevention efforts to help keep people from becoming addicted to painkillers in the first place. It's also going to strengthen state programs to monitor prescription drugs and to track when these drugs end up in the wrong hands. Now, for the people who've already passed from use of the medications to abuse and addiction, this legislation would help to launch treatment programs that are based on actual evidence of what works. There are a lot of treatment programs out there, lots of different opportunities to seek treatment. We want to make sure we can identify the ones that are actually succeeding and helping people, and then make sure that these programs are available to more people. Now, these are just a few of the positive ideas in the legislation. Senator Kelly Ayotte, who is one of the main sponsors of this legislation, has said that we can't arrest our way out of this problem. She's exactly right. The misuse and abuse of these drugs is illegal. We must acknowledge that fact. We must still try to do everything in our power to keep this misuse from turning into addiction and even death. There are states and communities and families suffering because of the abuse of these drugs. We can all be part of the solution, and we must all be part of the solution. So I know that the Committee on Health, Education, Labor, and Pensions is looking into another aspect of this subject. So is the Finance Committee. There are lots of ideas out there, and I'm glad to see members taking the issue so seriously. I'm glad we're moving forward with bipartisan legislations and solutions. Senator Ayotte has been a major force in talking about this problem. So have Senators Whitehouse, Kirk, Portman, and others. Another good idea is common sense in terms of changing Medicare Part D and Medicare Advantage. This legislation has been introduced by Senator Pat Toomey of Pennsylvania. I'm a co-sponsor. The bill is called the Stopping Medication Abuse and Protecting Seniors Act. That's it. Stopping Medication Abuse and Protecting Seniors. It allows Part D and Medicare Advantage plans to lock in patients to a single prescriber, a single pharmacy for their opioid pain medicine. This is going to do a couple things. It's going to deal with the issue of doctor shopping. That's when a patient goes to multiple providers to get duplicate prescriptions if they become addicted. Many private insurance companies already do this, and so does Medicaid. So we should allow and encourage Medicare to do it as well. These are all ideas with bipartisan support in the Senate. There are examples of ways that Democrats and Republicans are working together to help Americans who need help, who deserve help. The abuse of prescription drugs and heroin is happening everywhere in America. It is harming our nation. Congress must do what we can to stop it. And thank you, Mr. President. I yield the floor.